Good afternoon, everyone. My name is Gary Mizels. I'm the Human Resources Director here at Kentucky State. Apologize for the short notice on this meeting, and we are recording it, so this will be posted on our website, and if you have colleagues who were, well, I'm sure you have colleagues who are not here, because not everyone's here, clearly. There will be an announcement going out when it's posted, and certainly tell them it'll be coming. With these handouts that you have, will be posted as well. As you know, faculty voted as an entity, if you will, to be paid, for everyone to be paid over 12 months, 24 pays rather than 9 months, 18 pays. HR was aware of it, but we weren't involved in some of the discussions. And just talking it through the other day, I realized that perhaps the faculty didn't really understand the changes that might impact them. So let's try to get together, at least briefly, give an overview of how it's changing and what it'll mean to you. So that's what we've done. Again, I apologize for the short notice on this. So this is happening this academic year, 2012-13 is the first year of this transition. It is a transitional year. It's not a simple transition, and this we want to talk you through. This, excuse me as I refer to my notes, there are points I wanted to make, so I just put them down there so I wouldn't forget to make them. This landscaped handout. This compares how a 9-month faculty member earning $50,000 and their benefit deductions would have been handled under the 9-month pay schedule versus the new 12-month pay schedule. So column C, and the columns are, I put the labels across the top, so column C on the far left is the payroll number for the calendar year. Now payroll 10, which does not show, would have been the one above that first row, was the last check from last academic year for you. So you were paid in full last academic year with payroll check 10. Now in blue, you're seeing payrolls 11 through 16 were this past summer, and you were not paid for that past summer. Some of you had other appointments over the summer, obviously, but I'm talking about your academic year appointment. There was no pay, therefore no deductions. Now, I know in some cases, some people had deductions in error, which we apologize for, and we corrected that, but that was not intended to be taken. Column H in yellow reflects the paychecks you will receive in the current academic year, or this fictitious faculty member earning $50,000 will receive in the academic year. Payrolls numbers 1 through 18. Now, 18, you will note, is for the period that ends May 13, 2013. So although you're effectively on a 24-pay cycle, it picks up on the back, which is now pays 19 through 24, the ones that you didn't get paid for this academic year. You're going to get paid for, yeah, the academic year that just ended, I'm sorry. You're going to get paid for the following this academic year. Now, column I takes this fictitious employee and takes his $50,000 and divides it over 18 pays, as if we had not made a change. So that's this faculty member's gross pay over 18 pays. And you'll see on the back again, there's more blue because they would not have gotten paid, but the total gross is $50,000. Column J, again, shows our fictitious employee as we're going into this year. $50,000, but over 24 pays. So you can see the gross goes down per pay period, but at the end, on the back, you'll see matches saying $50,000. So you will be obviously earning the same amount of money. Now this is where it gets a little confusing. Benefit changes. Benefit changes go into effect May 16th. We take 2 deductions in May. I'm sorry, I said that wrong. May 16th for the first 2 paychecks, first paychecks in June. The 2 June paychecks, if you look at the top on the first side, in blue, check date June 15th and June 29th. Those 2 paychecks for 12-month employee. Deductions are taken for the July premium. Now, you weren't paid. So what did the university do? We've been doing this for a number of years. We've basically been paying on your behalf. Pay the university portion, but we were paying the employee portion as well. Kind of been loaning you the money, if you will. And then what was happening when you came back in the fall, you were paid over 18 pays, and you paid the monthly premium plus a recovery amount. So you're paying, I would say paying more than the 12-month employees because you weren't. You're paying the same monthly premium, but we had advanced you some money, as we prepaid the premiums for you for the summer, because you were covered during the summer, and we had to recover that. Over the whole year, over the 18 pays. So that was spread over the 18 pays after you came back. Okay? And short version is that's what's going to happen one more time, because we weren't able to start this 24-pay cycle with this past summer, because that would have meant paying you in advance of working, and we weren't going to be able to do that. So now although your pay is now being spread over 24 pays, your deductions for this last year are being spread over 18 pays, just like they have been. And that is in column L. Column L are your deductions. Now, in this example, we've got an employee with family coverage for the low deductible premium. Let's go to column M for a second. That's a 24-pay employee. Same coverage. They're paying $486.86 per pay period. And you can see at the very bottom, that totals for the year $11,684. The 9-month faculty member with that same coverage is going to be paying $649.15 per month, which is really, per pay period, which is the $489 plus the recovery amount spread over the 18 pays. So at the end, as you can see, the amount is going to be the same. And again, this is something we've been doing for a number of years. Just make sure I'm not skipping any points here. Yeah, that's right. I did make a note here. It's not here. This loan, if you will, these 6 pay periods, if you just sum the 486.86, reading upside down, times 6 is $2,900 that basically we have paid for you, and that's the amount that we're collecting. That $2,900 is spread over the remaining 18 pays. And that means at the end of the plan year, end of the plan year, we went through that. The end of the plan year, 24 pay and 18 pay employees have paid the same amount. That gets you to next May. And on the back, you're going to see we're assuming no pay increase and no increase in premiums. I think I'm going to be at least half right. Which half is right? Probably no pay increases. There will probably be an increase in premium. But for the simple example, no increase in pay, no increase in premium. So for this June, the 2 June checks, where under a normal scenario in blue you would not receive a paycheck, you will be receiving a paycheck. It's the balance of this academic year. We're still paying you for this academic year. But in purple, you're going to see the deduction plan year, benefit plan year. With the benefit plan year, the deductions start with the 2 June checks, and again, assuming no increase in premium, you will now be the same as every other 12-month employee. You can see the premiums are the same for a 9-month faculty member and for a 12-month employee. It's in purple. I'm sorry? The premium? Your premium should go, again, assuming no increase in premiums, yes. Right, yes. Yeah. It'll be June 15th, yep. Because the 2 June paychecks cover the July. I'm sorry? Oh, no, absolutely, I agree. Any help is appreciated. I want to say we will not forget. There's always a slim chance, but we will do our best not to. Somewhat, not everyone. That's correct. Well, The only deductions that should be, and I did mention earlier, there were some that were inadvertently taken because we failed to turn them off, and we restored that to the employee. But the only deductions that should take place during the summer are those that are basically based on a percentage. Retirement, taxes, obviously. Anything else, Doris? Retirement? Just retirement and taxes. Shouldn't have been anything else. If you think there's something wrong, let us know, and we'll be happy to look at it. And if there was an error, we'll refund that to you. You're welcome. Okay, so that's this. Now, the other handout. Was there? I'm sorry. Using this example, the paycheck would be look at this the right way, the $2,083.33. Now, the 24 spread, correct me if I'm wrong, Dolores, but I should have introduced these two people. I will as soon as I finish. The 24 spread employees were still paying premium over 18 pays, correct? That's the 24, yes. It should be the same. Again, differences in salaries or benefit premiums, yes, that's correct. Yes. No, I'm sorry. I said that wrong. This is the transition year, yeah. The deductions will be the same for the 18 pays that are in the plan year. We've got a calendar year, we've got a contract year, we've got a plan year. And then, of course, we've got a fiscal year. It does get a little confusing. So for the plan year, they will not change. They will change for the new plan year. And again, if all things stay the same in this example and in all of your cases, they will go down. Okay? After the end of June 30th, the June 15th paycheck, which June checks, again, will pay for July's premium. Okay? Yes, that's one way of looking at it. That's right. Right. And that'll complete the transition of pay and benefit deductions to 24 pays. Yes. Correct. That's right. Yes. Sure. No. We've taken care of that. Yes. Yeah, I meant to preface it. There was some buzz as people were milling into the room. Were we meeting so that I would be telling you that you wouldn't get paid Friday? No. No. That's not the case. Everything. Matter of fact, some of you may have seen some of the EPAFs because we place you. Well, this is again. This is the last summer we'll be doing this. We placed you on leave of absence without pay for the summer, again to make sure you weren't overpaid. And EPAFs were required to reactivate you. Well, a lot of the EPAFs weren't completed. A lot of them were hung up in the approval queue. So we went out there and we approved the ones that were out there, and we're activating everyone for whom an EPAF was not completed. We're making sure you're being paid. So we're taking care of that. Any questions before? Yeah. Mm-hmm. It would be best, because in some cases that's the only way we knew about it, but yeah, you would have seen it in the next check, or perhaps in the check after, because it would have been returned to you in your paycheck. Did we do manual checks for those cases? Yeah. If there was only one, there would not have been an adjustment. Yeah. Okay. Yes. Yeah, we shouldn't have told you. Yeah. Yeah. Just get name and ID, and we should be able to catch it in the next check, the first check that's coming up Friday. We have a little bit of time. Yeah. Yeah. No, absolutely, absolutely. You're welcome. Okay. Yeah. Correct. Correct. That's right. Yep. Plus any supplemental retirement we might have with TIA Craft or with ALEC, yes. Yep. Yep. Okay. And this other sheet is really taking what we looked at in this page on these two columns in the far right and just laying it out for plan and tier and health, dental, and vision. So you can see the focus that you're going to be looking at is column H, but obviously we're laying this all out for you. In the example we just looked at, column H was the 12-month, I'm sorry, there's the right way. Yeah, was the 9-month employee premium on the other sheet, the $649.15. And column K, looking the wrong way, column F was the 24-month, 24-pay employee. The difference between the two, this is the recovery amount that we talked about. In this case, was $162.29. So in that example that we just looked at on the other sheet, over the next 18 pays, that 9-month faculty member is paying an additional $162.29 for 18 pays. And if you do the math, $162.29 times 18 will total that $2,900 that I mentioned earlier as the kind of loan, the amount that needs to be recovered. And this just lays out, again, the health, dental, vision, and the different tiers and the different deductible levels. So you can see what the deductions will be. That's the H in yellow. And the amount of the recovery is K. I just wanted you to have that. Oh, I almost forgot. I did handwritten note I almost forgot about. If you are a new faculty member here for the first time, this recovery issue does not apply to you because you weren't covered last summer. So any new faculty members are going to be, they're being paid over 24 pays, just like you will be. But their premiums will be the same as a 12-month employee because their coverage doesn't start till October? October 1st, yeah. Yeah, October 1st. So the September paychecks will pay for October. We didn't advance them anything. There's nothing for us to recover. So if you happen to be talking to a colleague who's a new 9-month faculty member, say, I have the same coverage as you and my premium is less. That's why. They had less coverage. And it wasn't advanced for them by the university. Oh, a small detail I almost forgot, just to point it out. If you do all the math in this, you'll see, going back to the landscape sheet, in column L, which is, again, the deductions you would be seeing in this example, row 25, you'll see that deduction, instead of being $649.15, is $649.09, a few cents less. That's because with rounding, it normally would have been $649.15. We have a rule in the system that in that last pay period, in this example, we'll do with all the others as well, we'll only take $649.09 instead, so the bottom line is the same. Even though there's a little rounding in there, you will not be paying extra. We'll be adjusting that at the end. That's all I had. Again, I just want to make sure you had the information you needed so you'd understand what was going on in the transitional period. Any other questions? We'd be happy to answer. Oh, I did forget to introduce my staff. Dolores Shirley, Benefits Coordinator, and Candace Ragland, Human Resources Manager. Anything we can do? We'll be happy to help you. If not, I thank you for your time. We'll get this posted. Please tell your colleagues. We'll get this posted as soon as possible. Thank you.